Good morning, everyone. I'd like to call this meeting of the Cook County Public Health Human Services Board to order on this Tuesday, September 16th at 8:30 a.m. First item is the approval of the consent agenda. That includes our meeting agenda, minutes, financial reports, and abstracts and bills. Are there any adjustments to the agenda? Or is there anything someone wants to talk more about on the consent agenda? Plowman, please.
Chair Mills, just a small adjustment to the on the director's report. I would like to switch and go through item C first and then go through A and B.
Okay.
Because we have staff member Dagmara Smith, our economic assistance supervisor, who will be here to answer some questions if they are regarding the presentation Grace is doing. And that's why I'm requesting that change.
Sounds good. Thank you. Anybody else? Commissioner Gamble?
Yeah, thank you, Mr. Chair. I make a motion to approve the consent agenda as amended.
Thank you. We have a motion. Is there support?
Support.
Thank you, Commissioner Sullivan. Any further discussion? Hearing or seeing none, all in favor?
Aye.
Opposed? Motion passes unanimously. Thank you. Well, that moves us right down to our staff report. We have the potential local impacts of the federal and state legislative changes from Grace and from Dagmara.
All right. I'm going to let Dagmara know.
How quickly we move, you know.
Okay. All right. I will get us started, and Dagmara will be down shortly. Can everyone hear me okay? Okay, great.
Just fine.
So this presentation is in response to a request for information on how recent federal changes to specifically SNAP and Medicaid could affect services provided locally within the county as part of our economic assistance team. So our economic assistance supervisor, Dagmara Smith, will be joining us for a portion of this presentation in case there are specific questions that she would be able to provide more context on. So the specific legislation that affects both Medicaid and the SNAP program is House Resolution 1, which the President signed into law in July of 2025. There we go. And it was called the One Big Beautiful Bill Act, and this is the bill that includes changes to both Medicaid and SNAP. It is a very large piece of legislation, and I'm only going to talk about the very specific pieces that relate to SNAP and Medicaid. Otherwise, it would just be, we'd be here all day. So I want to hone in on the pieces that are relevant to work within our department. Another thing to note is that the timeline here is very long. It extends out to 2029. So different changes will be implemented at different points in time. So at the very end, I added a slide from when I did a run through last week with our local mental health advisory council. That group was also interested in this information. I did add a little bit about what that timeline looks like. And I think for the purposes of the board knowing about this, as you're looking at budgeting, I think that piece will be helpful at knowing which pieces will go into effect when, because that will impact, what the effect would be locally. Okay, so I'm going to start off by talking about Medicaid. So Medicaid is a state and federal health insurance program that provides coverage to individuals who meet eligibility criteria set by the state and federal law. So eligibility factors are household income, family size, age, disability status, and citizenship or immigration status. So if a person enrolls in Medicaid, which within the state of Minnesota is called medical assistance, or you might have heard it referred to as MA, that is the Medicaid program within Minnesota. Enrollees must demonstrate that they remain eligible at this point, at least annually. So Medicaid is the single largest source of health insurance in the state. It covers over 1 million people in 2024, which is over 20% of the state's population. And here within Cook County, it also provides a significant source of revenue for healthcare providers. So according to DHS in 2024, Cook County healthcare facilities received a total of $6,482,804 in payments from Medicaid for care provided within Cook County in 2024. Okay, now talking a little bit more about who is covered in Cook County. Medical assistance covers 1,025 people. This is in 2024. That represents 18.4% of the county's population. When you break that down by age, in the 0 to 19 age range, 52% of individuals, which is 459 people, are covered by medical assistance. 17.2% of adults ages 20 to 64, that's 493 people, are covered by medical assistance. And in the older adult age group of those 65 and up, 74 individuals are covered, which represents 4.1% of this age group. And that is because, there is a segment of the population of those 65 and older who may be eligible for both Medicaid and Medicare, depending on their abilities and other eligibility factors. So what's changing and what's staying the same? So after the federal government passed this law in July, now states have to implement the changes that are in that law in how they administer Medicaid programs. Like I said, different changes go into effect at different points in time, starting in October of 2026. We're still learning, the state is still learning how different entities will be impacted by the changes in the law. So the changes will affect states, they will affect healthcare providers, they'll affect county staff administering Medicaid and SNAP, and they'll also affect certain individuals receiving these services. So who will not be affected by changes to medical assistance? So most medical assistance enrollees will not be impacted by changes if they are getting coverage based on a disability, they're 65 or older, they're 20 or younger, or they are pregnant. So the changes are very specific to different eligibility groups. Okay, now I'm going to go into some of the specific changes. So the first change is more frequent Medicaid eligibility redeterminations. So one of the changes is that rather than requiring a redetermination every 12 months, certain individuals ages 21 to 64 who do not have dependent children, are not pregnant, and are not receiving medical assistance based on disability will need to go through an eligibility redetermination every 6 months rather than every 12 months. So this is a change that will go into effect January 1st, 2027. And the impact of that change, one of the things, so DHS is still estimating what the projected costs to counties will be, since some of the county-based eligibility specialists will be involved in completing redeterminations. And another potential impact is that medical assistance recipients may lose coverage if they do not complete renewals on schedule. All right, change number 2, Medicaid work requirements. So one change is that effective January 1st, 2027, and states can request an extension, is that certain individuals must show that they're engaging in 80 hours a month of community engagement. So community engagement means that a person must be working, engaged in public service, participating in a work program or an educational program. So this isn't everyone. There are exemptions. So people who are pregnant, under 21 or over 64, youth in foster care, former foster care youth under 26, members of American Indian tribes, people who are considered medically frail, people who are a parent or caregiver to a child aged 13 or younger, or a person with a disability, as well as people who are incarcerated or have been released from incarceration in the past 90 days. These groups are exempt from the Medicaid work requirements. So getting into the impacts, potential impact is staffing burden for eligibility specialists within PHHS. That's still uncertain. It's still unknown how often staff will need to determine compliance and how they will determine compliance for the Medicaid work requirements. Another potential impact is that individuals currently receiving MA who are subject to work requirements would need to meet them and provide additional proofs to maintain eligibility. A third change, also effective January 1st, 2027, is limits on retroactive coverage. So currently, if a person applies for medical assistance and they are approved, they receive retroactive coverage for 3 months. That will change to go from 3 months to 1 month. So if a person applies, on or after January 1st, 2027, and they are an adult without children, then their retroactive coverage will be 2 months. Let's see. Sorry, I should just read this verbatim. So it'll go from 3 months to 1 month for most adults without children, and from 3 months to 2 months for all the other eligibility groups. So potential impact is uncompensated care for providers. If an individual has a bill from that period of retroactive coverage and they no longer have that coverage, then there's a potential they may not be able to pay for that care. There is a potential for additional medical costs for low-income medical assistance recipients who apply on or after January 1st, 2027. Okay, the fourth change to medical, there's the retroactive coverage slide. Okay, the fourth change is cost sharing for some services. So this is one that goes into effect even later in 2028, October 1st. So certain adults without children who have incomes over 100% of the federal poverty level will be required to pay up to $35 per service for certain medical costs. And this members of tribes are exempt from this cost sharing. And several services are excluded. Services that are excluded include primary care, mental health, substance use disorder services, services provided by a federally qualified health center that would include Sawtooth Mountain Clinic, behavioral health clinics, and rural health clinics. And the potential impact of this change is increased cost for impacted individuals, avoidance of care due to potential cost, and again, an increase in uncompensated care for providers. The fifth change, and this is the last change for Medicaid, is a change in eligibility for some immigrants. This one goes into effect October 1st, 2026, when certain lawful immigrant adults ages 21 and older will no longer be eligible for Medicaid. And that would include refugees, humanitarian parolees, asylum grantees, and certain victims of abuse and trafficking. And the impact is that the MA recipients in those groups would no longer be eligible for medical coverage. I'm just going to keep going, and we can have questions at the end. There's just a lot of information here, and I'll make sure everyone gets the slides with all of the references in case you're interested in digging into where this data came from. All of the data on... Great, thank you. All of the data on medical assistance came from DHS. There's several web pages, sites within the DHS website that have information for changes related to medical assistance, and then SNAP is administered at the state level by the Department of Children, Youth, and Family Services, and so all of the changes related to SNAP are found on that website. So there'll be links to everything in the notes, so you don't have to be taking notes right now. Okay, we're gonna move into SNAP. So SNAP stands for the Supplemental Nutrition Assistance Program, and in this is straight off of the Department of Children, Youth, and Family website. So SNAP in Minnesota provides critical support to households facing food insecurity, including Minnesotans across all ages and abilities, especially those with lower incomes. It also upholds strict safeguards to maintain program integrity and prevent misuse. Eligibility is based on a household's size, income, and expenses. The application process includes documentation, interviews, and regular updates to verify eligibility. So what does this look like? So a person who qualifies for the SNAP program receives the equivalent of $5.46 per day in food benefits. Each month, SNAP benefits are loaded onto what's called an EBT card, which stands for an electronic benefit transfer card, which functions like a debit card. The person can use these cards at authorized grocery stores, convenience stores, and farmers markets across the state to purchase food. In Cook County, this is coming off of our economic assistance, the data that our supervisor, Debra, can pull out of that system. So in 2025, if you look at an average count per month of how many people are getting SNAP benefits, there's an average of 124 cases per month, and those cases represent 213 people. The difference is because a case can represent an entire household of more than one person. So of that 213, 143 are adults and 70 are children. And that total of 213 people represents 4.3% of the 2,700 households in Cook County, and that number is based on census data.
Please.
I just wanted to explain that further down the meeting here on the director's report, I have more information on 4 of the programs that our team administers with additional numbers, so I'll go over that in a little bit here.
Great, thank you.
All right. So the first change to SNAP is what's called the reevaluation of the Thrifty Food Plan. And this is a change that will happen at the soonest, October 1st, 2027. And the Thrifty Food Plan is what the federal government estimates to be the cost of groceries needed to provide a healthy, budget-conscious diet for a family of 4. So this amount is used to determine the SNAP benefit amounts, and those vary by household size. So the change is that as the government reevaluates the Thrifty Food Plan, that the cost to the government must be cost neutral. So the cost cannot increase over time. And the potential impact of this change is that SNAP benefits will lose value over time and reduce purchasing power for recipients. And that local retailers will thus experience reduced spending from the people receiving benefits. The second change is modification to SNAP work requirements. So this is effective as soon as federal guidance is available on they updated the definition of able-bodied adult without dependents. And for people who qualify under that category, they will now have to be working or in a work program at least 80 hours a month. So there were SNAP work requirements before, but they're changing. Who is subject to those requirements is what's changing. So who is exempt? Households with children under 14, American Indians, geographic areas with a waiver due to unemployment over 10%, and those unable to work due to a physical or mental limitation. There are also groups who were exempt in the past and will no longer be exempt, and those groups include veterans, people experiencing homelessness, and youth leaving the foster care system. The third change to the SNAP program is administrative cost sharing. This is a change that will go into effect October 1st, 2026. The change is that at this point, the federal government reimburses 50% of the cost to administer the SNAP program to states. And that will lower from 50% to 25%. Which means that states will now be responsible for 75% of the cost of administering the program. The impact of this is that fewer federal funds will be available to states to administer SNAP at a state and local level. Okay, The fourth change, and I believe this is the last change to the SNAP program, is non-citizen SNAP eligibility restrictions. So this is effective as soon as guidance is available from the USDA. And what changes is that certain non-citizen applicants will no longer be eligible for SNAP. There's a long list. I'm not going to read it all out. I will send the link to the list embedded in the PowerPoint to the Department of Children, Youth, and Families that really spells out in great detail which immigrant groups will no longer be eligible for benefits. Okay, this is one that actually has already occurred. So there's a program called SNAP Ed, which was a nutrition I guess it hasn't already occurred, but so SNAP Ed is a nutrition education program that was funded through the USDA, and the funding for that program has been eliminated effective October 1st of this year. So we did not have any of this funding at the county level. However, we did have a regional SNAP Ed representative. This program within the Arrowhead region was administered by the University of Minnesota Extension, and the staff person who was serving the region was based out of the University of Minnesota Duluth in their extension office. We were working with that individual as a partner through the Food Access Council and the local food shelf to explore options related to what's called the super shelf model, which is a model to provide fresh foods in food shelves, basically. So that individual is unfortunately no longer employed, and that was effective within the last month. Grand Portage also did have SNAP Ed funding. They did have a SNAP Ed nutrition educator. According to their health services director in an update, the band was able to come up with additional funding to support that individual and continuing to provide SNAP Ed nutrition services on the reservation. So, okay, this is not a specific, well, this next update is a little bit different. So this change is fees and penalties for states based on what's called the payment error rate for Medicaid and SNAP. So the effective date is different. This change will go into effect October 1st, 2029 for Medicaid, and for SNAP it will be October 1st, 2027. So the basic premise is that if a state has over a certain % of payment errors, they will be financially penalized by the federal government. So for Medicaid, that is over 3% of payment errors. And we're not exactly sure at the state level, according to what I found on DHS and DCYF websites, what that will mean. They're still looking for additional guidance from the federal government. For SNAP, it's a tiered system, so states will pay between 0 and 15% of SNAP benefit costs, so not administrative costs, but the benefit costs going out to individuals depending on what their payment error rate is. So a lower payment error rate means a lower percentage of what the state is responsible to pay for benefits. A higher payment error rate is tied to a higher percentage that the state pays for benefit costs to SNAP recipients. Okay, so this is what I added here, which is the timeline of changes. So for 2025, the things that are going into effect are the modification of work requirements for SNAP and SNAP eligibility restrictions for non-citizens. 2026 changes will go into effect in October, and those changes are Medicaid eligibility restrictions for non-citizens and administrative cost sharing for SNAP. 2027 is when the bulk of changes will go into effect. Those include the more frequent eligibility redeterminations for medical assistance, work requirements for medical assistance, limits on retroactive coverage for medical assistance, the reevaluation of the Thrifty Food Plan for SNAP, and state penalties based on the payment error rate for SNAP. Additional changes that go into effect in 2028 include the cost sharing for certain MA recipients. And in 2029, the last change to go into effect would be the state penalties based on the payment error rate for medical assistance or Medicaid. And then this is where all of this information came from. So these are all of the sources that you can dig into if you're looking for the original context. So we have time for questions. And Dagmara, you should come up here to the mic because you might be able to answer some of these questions better than me. Okay.
Commissioner Storley. Morning, Debra.
Thank you. Good morning. Thank you for that overall report that I just went through with AMC at our local meeting last week. But I'll just briefly say, this is just kind of the umbrella of what we have to look at as far as staffing goes. And I think it's kind of awesome because we don't know how many specialists we need that'll be required to do all of these programs. So I guess we have to remain quite loose and understand that at each increment here, how much is it going to be for SNAP, documentation, interviews, and follow-ups, and all of that. So that's going to affect your staffing. Plus, and I won't go into the whole thing, we debated what to do for the systems to be able to take what you already have, putting something into your system which is very inadequate. And let me support you by saying, with the health committee that I belong to, AMC, we're going to put together a package for our legislators to understand the difficulties of all of your inputs and outputs and how it takes 30 minutes to get any kind of system going with one person. So I just want you to be aware that I'm there for you to help you administrate these programs and make it a less challenging type of time to do it. So.
Thank you, Commissioner. Commissioner White, did I see you?
Yes, the question I have is this payment error rate. How accurate is Cook County in the reporting? That's part one. And then part two, it states that it says that if the state is in non-compliance. So how is that fair? Because even if Cook County is right on, who ensures or provides real oversight on all of the other departments in the state to keep that error rate down?
Yes, this is a very good questions and concerns that were addressed at our supervisor meeting that we had kind of like across the state. Right now, we are going through SNAP management evaluation review. We do not have final answers as of today of what our error rate is. They do that every 3 years. I'm hoping by the time when it's time for my presentation in November, we will have those numbers of what error rate of Cook County is. But the state level is, I believe, is at over 10%. Mm-hmm. And yes, the counties, the small and the big, especially small counties, are kind of asking those questions. Is it gonna be, we're gonna be looking at a state error rate as a whole, and that's gonna be evenly spread between the counties, or are we going to look county per county and see if there has to be cost sharing based on their error rate? A lot of this is still at the state level, is really at the discovery phase. They are looking at the federal changes and then also at state changes and seeing how this can be implemented. They are looking to see if they can request a waiver. So we don't really know much yet. There is nothing set in stone. But yes, the SNAP error rate is higher than they would like to see that at the state level, and they're trying to see how they can address that. The biggest thing is really system modernization, and we actually were able to talk to some eligibility workers who work just in Wisconsin, and they say, and now they are working in the state of Minnesota, and they're saying, I don't understand why do we have to work with such outdated system. In the state of Wisconsin, we can do this, we can do this. It takes, very short time to do our work. In the state of Minnesota, we are very behind with the system that we use. And then also frequent changes don't help with the error rate. So yes, that's something that we will have to wait and see.
And yeah, it's not fair, I would say.
Yeah.
And also, it's not till 2029 where the error rates hit home, right? Like that's.
For medical assistance, for SNAP, I think it's going to be, it's going to be sooner.
And what I think I understood from the conference as well is that if you have an error rate higher than 13%, then your implementation can be delayed up to 2 years, which I thought was really strange to have that higher error rate and then not have to do the implementation later. It just seems all very convoluted, but I probably don't understand it as well as I could at this point, but.
Yes, and it's a very interesting concept. I think implementing that error rate, it almost like puts accountability on the state that, hey, you need to administer that program correctly. You need to make sure that you provide a system that works correctly. You need to make sure that you provide proper training. So yeah.
Commissioner Campbell.
Yeah, thank you, Mr. Chair. Thank you, Grace, and those that helped put that together. Anytime that there's change, it can be intimidating, and so tackling it to try to help us and diffuse some of that angst is an important element to put things in context. I think overall, to try to simplify, if intention is to try to build integrity in the system, and there are many examples where we see where we need to step back and reevaluate so we can build integrity in a system. We need accountability, which is referenced. Public Health Human Services is such a large service to get a hold of with all of its various component parts. And to be effective in it, we need to equip the people that we ask to do this and provide this service for our community. And as Commissioner Starley represented, and as we heard at AMC, the state of Minnesota is way behind in coming alongside and equipping us to do the job. And we've often referenced that good people with good hearts that intend to help people, that if we're encumbered because our processes are archaic, and they get in the way of allowing us to be who we want to be and servicing our community, something has to change. And so it is something that is constantly being brought before the state. We need to change. We need to look at other states that are doing it and are doing it far better than we are. And so it's multi-layered in that we have changes that are brought about by administrations, and there's reasons why those changes are implemented. We have to look at the level of services that we provide, understand how those services get delivered, and understand the compliance and accountability components of those services. And we're not doing a good job in coming alongside and helping our people to be able to do what we've asked them to do. So compliance is a huge issue. If we can make our systems facilitate the process quicker, easier, and allow the heart of what we do to be evident, it would be a whole lot better. So just simply to summarize, I think there was much discussion recognizing we've got problems that we need to address, and we can't continue to allow them to go because it's burning out people that want to serve people, but the systems are preventing us from doing it. That's a reality that needs to be addressed respectfully, but do something about it, as opposed to letting it go on year after year after year. And so identify what we're called to do, equip the people that do it, build in accountability that makes sure that our error rates and our efficiencies, our financial stewardship, all of these things combined so that we can celebrate what we do in public and health human services, feeling that everybody is working together for a common good, as opposed to having all these pieces that seem to be broken or archaic that are impeding our ability to do the work that we're called to do. So keeping track and monitoring as change comes along, respectfully addressing the challenges, and getting those that have jurisdiction or authority to do something about it, and then with change, evaluate whether those changes have been effective and they're contributing to the level of service we provide, the fiscal responsibility, and the ability to keep and retain staff because they feel they can do their job and they're not encumbered by processes. So, again, appreciate the information. And as to the counties, 87 in the state of Minnesota, accountability as to error rate, 87 counties need to respectfully hold the state accountable because it impacts us if, in fact, they are not meeting the requirements relative to error rate. We are the ones that have to hold them accountable because it reflects on our ability to do what we do and to have the financing we need. So, a lot of rambling, but it is a multifaceted issue that needs to be addressed. So, thank you.
Thank you, Commissioner. Commissioner Selvin.
Thank you, Mr. Chair. I'd just like to request that if you have ideas as we talk to our legislators this fall and as the session starts in 2026, please share with us those ideas. We want to work with you and make sure that our legislators are informed as to our specific needs. So keep that in mind, please.
Thank you.
Frank.
Thank you. First, just an observation. Some of this is referenced back to the federal poverty level. And just to give a ballpark, for a single person, the federal poverty level is set at about $15,500 per year. For a family of four, it's about $30,000 per year. So that's the federal definition of the poverty level. Question I had was on your SNAP cases, which looked like total about 4% of the population. Is that new enrollees monthly, or is that total caseload?
Total cases.
So, and again, roughly, just trying to get my ballpark here.
Yeah.
The eligibility for SNAP is similar to the eligibility for medical assistance. Is that accurate, roughly?
In what criteria?
I'm sorry?
In what criteria?
And
Like,
what criteria?
how would you make it?
Mostly income.
No, medical assistants actually have higher income limits than food support would have.
Okay, and the reason I was asking for that was I was looking at the difference in the caseload, where about 4% of the county population is eligible for SNAP, but almost 20% is eligible for medical assistance. So it's more stringent criteria for SNAP?
Yes, the income limits for SNAP are definitely lower. Also, within medical assistance, there's different income limits. So the children will have way higher income limits than the adults would have. Also, SNAP have additional requirements. You have to do an interview. You have to provide more verification. So it definitely is different.
Okay. And again, it just seemed to me like that 4% number seems extremely low. And I was wondering if there are a lot of eligible people out there who are not going through the
Could be.
hoops to qualify? Or is it just that they don't need the food assistance, which would be very
Could be.
surprising to me?
Yes.
I can add that there is in the health assessment data on, I think it was estimated by Feeding America, and then the percent of people who maybe can be classified as food insecure but do not qualify for programs due to being over income. So I can pull that out, but there is a population that may be in need of assistance and is not eligible under the current criteria. So that is part of the story. It's not the whole story, but there could be a combination of things. There maybe are people who haven't applied and would be eligible, and there could be people who are in need of food assistance and are not. So it's complex.
Thank you, thank you.
Are we allowed to use the eligibility, if someone is MA eligible, are we allowed to use that eligibility for our own programs if we created county programs?
I mean, I think any of the programs that use federal or state dollars, we are restricted to using the eligibility criteria that the state and federal government set for us. I suppose if we were to create something using entirely local resources, that we would maybe have more authority to choose how those resources are used.
Thank you. And do we have a number on that thrifty food plan? Like, what is that dollar amount for a family for a week?
I can look it up. It is referenced in the slides.
Oh.
It'll take me a minute to
Oh,
pull.
sorry, I didn't catch that.
No, it's not. I mean, the place I got
Gotcha.
the data is referenced.
10
The
for.
exact amount is not.
Thank you.
So,
Well, thank you very much. Any other questions or comments? You don't have to spend time doing that now, but unless it's super easy.
okay.
Thank you.
Thank you.
We might be on the hook for one more thing. Okay. Alvin, I'm going to turn it back to you.
All right. That moves us on to our next item on the agenda, the director's report. And we're going to start with C first and then do A and B. And so for C, we have the Economic Assistance Program compared to the state of Minnesota. I'll hand it over to Plowman.
Thank you, Chair Mills. This is in response, well, first, I want to thank Dagmara and Grace for this presentation. We're a small county, and those changes will have impact to us, and it's good to know, kind of beat the curve and know ahead of time what those changes are going to mean for us when we go through the budgeting process, through organizational process, and trying to figure out what resources we're gonna need and what impact it's gonna have on our budget. So thank you so much. The presentation I'm going to do is also in conjunction that I prepared with Dagmara, our Economic Assistance Supervisor. It's going to, can we put that on the screen at all?
Which one?
The
4C.
The assistance programs in Cook County when compared to 4C. This comes in response to the question I received from the board during the last Public Health and Human Services meeting when we presented the budget for 2026, and the question was regarding the personnel expenses under economic assistance versus the county administered programs that were in the budget as an expense. For a reference, we have 897,000 in payroll or personnel expenses for the economic assistance for the entire 2025. And in the budget, we have just under $300,000 of county administered programs. And I want to make that clear. What's in our budget is funds that are paid by the county directly to the clients for which we seek reimbursement from the federal and state governments. The information that I'm going to present right now is programs that are administered by our economic assistance teams for which the county does not pay any dollar amount to clients directly. Instead, those funds flow from the federal and state funds to clients, okay? I'm just taking a moment to, hopefully we get the presentation on the screen, if not.
While we're waiting.
Yeah.
I just emailed to you, Commissioner Mills, and to Grace, and to Mr. Dimitrov, a PDF of the monthly food plan cost, the thrifty food plan cost, as of January 25. So, and maybe you can forward it to the rest of the members if they would like. And you see it does vary by the age of the child, whether you're male, whether you're female. It does not include the fact that food costs in Grand Marais are a heck of a lot higher than they are in most places in the country.
I'm not sure why it's not showing.
Does everybody have that information in front of them?
Yes.
Okay.
Yes, it is.
I have it on
It's
there.
right here.
Oh, it's on your personal.
It's page 19.
Thank you.
It's page 19, plumbing.
And, yeah, I can just read out loud what Frank sent while we're waiting here. Let's see here, weekly cost for a family.
I can start presenting.
Okay, well then I'll be quiet.
Yeah. So what you see is the four major programs that are administered by our economic assistance teams. And on the bottom, you'll see the average for the state of Minnesota and Cook County. And in addition, we'll have the healthcare programs that are also administered by our team for case number only. So I'm going to start with the Supplemental Nutritional Assistance Program, or the SNAP, also known as food support. For the state of Minnesota, average count per month of cases is 213,000, while for Cook County, that is 124, or 6%. That is through the month of August. Then further down, you'll see the state of Minnesota dollar amounts year to date at $493 million for SNAP benefits to Minnesotans. That number for Cook County is 249,000 through August. Okay, or that's 5% of that amount. The average payment per case in the state of Minnesota is 289.
Plowman, can I stop you?
Yes.
So the percentages I'm showing on the sheet are .06 and .05. You reflected that it was 6% and 5%?
I'm sorry. That is correct.
Okay.
The sheet is correct. I was incorrect. I apologize.
And what is the percent of? In other words, that 250,000 from Cook County.
Comparing to the state numbers.
The
Comparing to the state
So
numbers.
we're 0.05% of the total state.
Correct.
Correct.
That is correct.
Correct.
So the average payment per case in the state of Minnesota for SNAP, $289
Per month?
per month. For Cook County, that's 251. An average payment per person, 161. Cook County, 146. So again, those percentages in Cook County are slightly lower than the state of Minnesota at per case at 86% and per person at 90%. Okay?
Commissioner Gamble has a
Mr.
question.
Yeah, Plumman, to understand these numbers, if we're looking at a what we're providing in this, we're looking at the SNAP and the food support, and how Cook County reflects as a percentage of the state in that particular area of service. It would be helpful, and this is based upon demographic, to also understand, not that we need more work, but it helps put things in context, how this compares. Let's just say Aiken County. The reason I'm saying that is because our demographic relative to those over 65 years of age, if we amongst the 87 counties in the state have the highest percentage of people that are seniors, that how that affects these numbers. So when we look at in the state, that's a combination of the population as a whole. When we look at demographic specific relative to our demographics in Cook County, what we can say is, we might say in some areas that because we have of the state 87 counties, the highest elderly population, that tends to affect these numbers. The reverse of that might be said, whereas if we're looking at poverty and we're looking at our wage and we're looking at young people, where that figure relative to the state, it is influenced by poverty level. Whatever the criteria is that you want to make the comparison on to help understand these numbers. And if we look at them comparatively with other counties, we can find out this is something that we see as a result of our particular demographics. So the state comparison is helpful. The comparative that would break it down further to put it in context would be the comparative relative to demographics.
I understand. I thought I was responding on the question why our payroll is at a certain amount.
Sure.
When we compare the county administered program funds that are leaving the county at that amount. And I was providing a total amount of funds administered by our economic assistance team for an entire year. But I can certainly provide additional
Yeah,
information.
and I appreciate that. It just
Yep.
sort of mines out some of these other questions or
good.
information. Thank you.
For general assistance, also known as GA, the state of Minnesota average cases per month at 26,000, in Cook County 10. And then I'm gonna go down to the dollar amounts. For the entire state of Minnesota, dollar amounts year to date, 53 million, in Cook County 19,000. Average payment per case in the state of Minnesota and per person at 252. For Cook County, those numbers are 260 and 235. This is one example where the average in Cook County is actually higher than the state average, okay? Any questions on this? I'm gonna move on to the Minnesota Supplemental Aid, or also known as MSA. The state of Minnesota average per month cases at 29, in Cook County 18. And further down, the payments year to date for the state of Minnesota, 45 million, 17,000 for Cook County. Average payment per case in the state of Minnesota, 189, in Cook County 126. Average payment per person in the state of Minnesota 185, in Cook County 126. In Cook County, lower percentages than the state of Minnesota. Okay? All right, so for the Minnesota Family Investment Program, also known as MFIP, the state of Minnesota count for average cases per month at 22,000, in Cook County 10. The dollar amounts, total payments year to date in the state of Minnesota, 195 million. In Cook County, 88 million. And the average payment per case, about 1,100 in the state of Minnesota, 1,100 in Cook County. And average payment per person in the state of Minnesota, 404. In Cook County, slightly higher, 426. And I'm gonna take your attention to the totals for the state of Minnesota and the Cook County through August. In the state of Minnesota, that dollar amount is $787 million. and Cook County, that's 375,000. And if we did a projection, for Cook County, that number is going to be through the entire 2025, based on year-to-date through August, $563,261. That's in addition to the 300,000 that county funds that are in our budget, okay? And lastly, the healthcare, the 1 month only, that is another program that our team, economic assistance teams, has to administer. As of July, the numbers for August were not available. As of July, we had 922 healthcare cases in Cook County. Okay? Any questions?
Commissioner Gamble?
Thank you, Mr. Chair. Thank you. If you're a statistic nut, you appreciate this kind of stuff. But the reality is that when we look at numbers like this, it brings substance to what we actually do. So it helps give us context for decision makers. So I really appreciate the effort that's put into doing this. I think the thing that we look at when we say how are we doing, and what are the unique things that exist in Cook County that might not exist elsewhere that affect these services and our costs. And certainly when we're looking at policy at the legislative level, we often talk about the cookie cutter approach that comes out of legislation that doesn't take into consideration the unique circumstances that exist in each of the individual 87 counties. So looking at these figures and basically mining out the information and what it tells us helps us to make better informed decisions in response to how we provide services and how we advocate on behalf of our county when it comes to legislation that reflects our uniqueness. So I really appreciate the numbers, and it's something that if we look comparatively and deeper into what these numbers reflect, it definitely helps inform us when it comes to decision making, to see the unique things that we're challenged with.
Administrator Treble.
I have a question, so if Plowman, I think he was planning on responding to Commissioner Gamble.
No, I wanted to, thanks Commissioner Gamble. What I didn't say at the beginning is this is from the Maxis centralized eligibility system. This is a public information, and all these programs are required for our county to administer. So just wanted to explain that.
Thank you.
Thank you, Chair Mills. Plum, I have a question about the MSA, the supplemental aid. Can you help us to understand why that percentage is lower than the rest of them at 66 and 68% payment per case and payment per person?
So what I can speculate why that would be lower. MSA, it's a state program, and the monthly assistance standard is just $81. It doesn't matter how much income you have, what time and amount you applied, and it's always going to be $81 per month. But there is additional payments towards that program that could be a result of a special diet that someone would have, or housing assistance. And I think the majority of those 18 cases are just straight $81. Only few would have the special diets in it. And then also we usually do not see that housing assistance within the MSA for the residents of our county. So yes, I would say that this is the factor.
Okay, thank you. That's helpful.
Thanks, Debra.
All right. Thank you, Plowman. Thank you, Dagmara. Thank you, Grace.
I'm gonna move on to staff updates. Well, first I'm gonna start by saying that our director's position is now posted and we are actively recruiting. I am not, I have decided not to apply for this position, and so the result of this recruiting process will be that the agency will have a new director, okay? I will continue to work as hard as I have to and I need to provide support to the new person, and in any capacity that I'm asked to, but ultimately we will have a new leader in this job. I want to thank the entire PHHS staff for all that they've done for the period that I've been an interim director. Everyone has worked really hard, and we continue to work as hard as we can to provide services to clients in our community. I'm going to continue to provide an update on some of the recruiting efforts. We have interviewed really good candidates for adult mental health position, adult mental health case manager position, and adult home and community-based services supervisor, and the children and family services case manager. The team, the interview panel, has made a recommendation to our human resources director to pursue hiring of the selected candidates. So I'm hopeful that by the end of the week and by the end of the month, we have some new staff members on our team to fill vacancies that are very important. We did have one staff resignation this week. Our children and family services case manager, Stacy Schmidt, has resigned effective yesterday. I just received a notification from the worker yesterday. I'm working with our children and family services supervisor, Nancy Deming, to recruit for a long-term solution is to find a children and family services person full-time. The short-term solution right now we are looking into is to hire a temporary worker from an agency. We've done this in the past under the children's mental health case manager and worked really well, so we are actively working on that this week. We do have our adult mental health case manager leaving the agency at the end of the month. We are well aware of that departure. That worker actually had resigned and came back to help the agency through our transition period, for which I want to thank Lily for doing that, Lily Gruber-Schultz. There is a sense of urgency for us to fill the adult mental health position as soon as we can to provide much needed transition and overlap between the departing adult mental health case manager and incoming. And we're working as fast as we can to move the recruiting and an onboarding process. In the meantime, we have Mr. Dave Lee, who the board approved the contract with to provide support and assistance to the behavioral health team. He's been with us only for a couple of weeks now, and it's been essential for our agency because he comes with a lot of experience and a lot of knowledge in the adult mental health area and other areas actually in the county government. We are very thankful to have him on board to provide support to our team. I was, in the months I've been an interim director, I've been working with several members of our team and the county attorney's office to address findings from the Wilderness Outpatient Treatment Program audit. We received an all clear letter yesterday from our licenses in the state of Minnesota with all the findings from the report have been resolved. I want to thank Mr. Neil Pedersen from the county attorney's office, Erica Turnes from the executive administrative assistant, Brenda Port, our SED case manager, and Greg Bernier, our licensed and alcohol drug counselor, for their work in resolving these findings. And my message to the new director is to continue to follow the changes in this program and address changes as they occur rather than address findings in the audit report, which takes a lot of time and effort to resolve. But those are now resolved and we have an all clear, so we can continue. We have been able to continue to provide services, but now it's, we have an all clear from the state, and that is something we've been working in the last several weeks with the team. I think that's all the updates I would like to provide this time.
Administrator Tribble.
Thank you. I'd just like to add, thank you, Plowman, for the director position. It does close tomorrow. So we anticipate moving forward next week with the first round of interviews, with the second round shortly after that. So we're moving forward fairly quickly with that. I wanted to thank Plowman for his time and service as the interim director, which is continuing past today, but I just want to acknowledge today the work that he has done. He has been instrumental during this time and has been a very strong leader. And so thank you, Plowman. I appreciate your services and the time and effort that you've committed to this. I would also like to thank the staff. As you see with our org chart, we have a number of vacancies. And what that means on the ground is that staff are doing double duty. They've really dug in and are ensuring that they're providing services for the community during this time frame when we have so many vacancies. So I'd like to, from my heart, thank the staff for the work that they've done during this time, because it has not been easy.
Mr. Campbell.
Thank you, Mr. Chair. A question I would have, well, you know, living on the shores of Lake Superior, we have a lot of books in the library and at different stores talking about troubled waters and incidences where rough waters have been challenging, and certainly in our public health human services, as the public knows, there's discussion because we have some challenges, and we've tried to, as commissioners, reinforce the fact that we're addressing these challenges. Our appreciation to Rena and her willingness to step up and be willing to open that door and walk in and do this evaluation, which puts pressure and sense of angst and uncertainty on all of our staff in that department and the community, because it's a big element of our service outreach to our community. But trying to hold the rudder steady in the midst of this is what our objective is, and to approach this with integrity, which we've done by bringing certain individuals in, and it speaks to your leadership and your steady hand, which is hugely important. And I would just encourage, which I've said over my lifetime in dealing with difficult things, is never be weary in well-doing. It's easier to say than it is to do. But the question I would have is, with these open positions in our compliance requirement as what is mandated, are we in any position vulnerable because of open positions? That's what I would say, is are we complying with requirements given the circumstances and our response to it? Is everything good, which is a statement to the community that we are handling this process and this difficult situation with integrity, and stepping back and using this as an opportunity to evaluate our services and how we deliver them, with the intent of being more effective and also contributing to more longevity in these positions, because we come alongside people. So that's my question would be, is with all of these positions that are open, is there any issues of compliance?
Do you want me to start, Plowman, or do you?
Sure.
Okay, so I can jump in and start with a response, and then Plowman, please add to that. I would say that we are doing the best that we can to ensure compliance in all areas. That being said, we are very lean in terms of our staffing in two of our areas, which are behavioral health and children and family services. So we are working with our consultants, and Plowman is taking the lead on this, ensuring that we have staff necessary to be in compliance in all of those areas. So for example, like he mentioned, we are recruiting for several of the positions. We are actively making offers very soon for some of the positions so that we can fill on board and ensure that we're filling those vacancies. If you look at the org chart, like I mentioned, those two areas, the Children and Family Services and the Behavioral Health Services, are the two areas that we're prioritizing to ensure that we have staff in place. We are also, like Plowman said, looking at some temporary solutions so that we have some temporary solutions for staffing. And it has been helpful to also have the two consultants on board to help us with ensuring that we're triaging and prioritizing the highest risk areas to make sure that we can continue to provide high-level services for the community.
If I may add a couple of things. Well, thank you for the kind words, but I want to make it clear that where we're at today with meeting requirements is because of the staff who's working very hard to do that. And very little, all the credit should go to the staff and very little to me, because no person can do this alone and by themselves. This takes an entire organization to do the work they're doing. The short answer to your question, Commissioner Gamble, is yes. We are meeting requirements. However, that is coming at a price of people having to wear multiple hats, working long hours, covering for different programs that they don't always typically work under. And so I think this I'll take as a learning experience for me, and I'm going to be a strong advocate for building an organization that can is first of all thoughtfully put together, and that it is intended to provide the team with the resources and the support that they need so they can perform their work without having to spend many hours, and that our staff lasts, if you want to call it that, on the job longer than just a few months. And instead, to me, losing staff members is our biggest challenge. It comes with a price of training, onboarding, loss of revenue, all of the above, which creates organizational challenges on many levels. But the short answer is yes, we are meeting requirements.
Yeah. I appreciate your perspective and the wisdom in response to the challenges. I think it's very forthright. It's transparent to our community, and these are things that we want to anchor as we move forward, because these are all very important things. And certainly people who feel valued in what they do, and our degree of empathy that comes from leadership empowers them and creates loyalty, which is hugely important. So I appreciate your comments. Thank you.
All right. Oh, that's all for agency updates, and that's correct. We have our administrator's report up next.
Okay, and I'm actually going to sit over there so that I can use the clicker. That's all right, Chair?
Please feel free. Yep, of course.
Thank you. All right, to follow up on Plowman's presentation, I will be presenting on some of the things that have been happening within PHHS, and I did not attach the presentation to the materials because things have been rapidly changing, and I made changes as of this morning due to some of those items. So I apologize for not attaching it, but we can send it out so that you all have it following the presentation today. So, as you're all aware, there have been several investigations that have occurred within PHHS due to grievances and complaints that have been received. Leaders before me and our HR director and county attorney took the responsible and appropriate approach to have a complete investigation for each one of those complaints or allegations that were received. At this time, I can report to all of you that all of the investigations have been completed. I will also cover some issues that we have discovered as leadership transitions have occurred within PHHS. I will be covering this topic as our interim director, Plowman, was not engaged in the investigations. He has been an instrumental leader in identifying and addressing the operational issues, leading the team, and will be assisting with answering questions at the completion of this presentation today. The findings from the investigation and our own internal work show that we have many areas of improvement needed. I tried to categorize the findings from the investigations into 4 different areas of improvement that are needed within PHHS. Those categories are policies and procedures, revenue and expenses, client services, and work conditions. So I will walk you through each one of these. So the first one, policies and procedures. As you're all aware, we experienced a data breach. This was one of the investigations. We had 48 clients that were affected by this breach. Each individual subject to the breach has received a letter from the county outlining the specifics concerning their specific breach and information that was accessed. We have had several of those letters returned to sender, and so we are now actively working on finding addresses to make sure that each individual receives their letter. We're also actively taking steps to mitigate the risks and put controls in place so that we do not have future breaches. We know that we need to review and update our policies and procedures in this area, and we're working with our 2 consultants to ensure our policies and procedures are aligned with current best practices. Some of those places where we know we need to improve our time reporting, SSIS, which is the Social Service Information System controls, and other areas. All right, so I'll move on to revenue and expenditures, or revenue and expenses. At this time, we currently require 90% real-time reporting. So this means that social workers have to put their time into SSIS for the time that they're spending working with their clients, as well as non-case related time. We have a policy that requires 90% real-time reporting. We are not meeting that expectation of 90%. This time reporting is essential as we need the time in SSIS to bill for the work that's occurring. If the time is not accurate, it affects our ability to collect reimbursements, which is one of the things that we saw in the investigations that were completed. Many counties require 100% real-time reporting. We anticipate changing our policy to 100% real-time reporting, and will be with that at the same time implementing controls to ensure compliance with that policy. We'll be working with our consultants on the time to implementation to ensure that we're training staff and working with our staff to make sure that they have the tools and resources needed to meet this new compliance. The next area is flex funds. Flex funds are goods or services purchased to meet basic physical and medical needs. Examples include funds for clothing, for food, for auto repair, and things of that nature. We're aware at this time that we do not have appropriate controls in place, including a written policy to ensure compliance with the utilization of our flex funds. So this is another area that we will be working on as we move forward. Lastly, internal controls. Updating our policies and procedures will provide additional guidance and ability to ensure compliance with rules, statutes, and expectations within this PHHS space. The issues that occurred were not with our financial team, but rather were due to not having the controls in place to ensure that cases were fully billable due to the lack of organizational leadership. I mention this because we have excellent staff in place, as Plowman mentioned earlier, and I mentioned. And with our interim director and the consultants, we believe that we can improve by providing the support, the guidance, and expectations to staff. Client services. We are currently working with DHS on a performance improvement plan for some of our child welfare cases and a compliance plan that Plowman had mentioned earlier with our wilderness center. Correction items were raised to ensure we're in compliance with statute, and we received notification yesterday of our approval for the Wilderness Center, so that's good news for us as we move forward. These were issues that were not identified in the investigation. However, I bring them to your attention as we had the transition in leadership and as I started, we discovered that not all key stakeholders were aware of these issues. So we wanted to bring it before you to talk about this gap so that we can move forward with fixing it and doing better in this space. Quality assurance and controls. As you all know, we're working with 2 consultants to assist us in ensuring we're providing the best services we can for our community. We will be leveraging them to explore best practices and have them assist us with implementing the necessary changes. Lastly, work conditions. We currently have, again, Plowman in place as our interim director, who has been key during this time, and we know that we need to move forward with hiring a permanent full-time director, which we're doing. We also have several positions posted, which Plowman walked us through, and reviewing other positions to ensure that we're hiring in the right places, the right positions, to ensure organizationally that we're effectively meeting all needs. One area identified in the investigation is that we had some areas within PHHS that had a challenging work environment. This was identified to be due to lack of leadership, organizational guidance, and support for staff. We're working to change that by providing support services for staff, but also know that it's going to take some time and attention. We're planning on having our EIP service provider come in on October 1st and 2nd to work with staff, providing some individual support services for them, and then we will be moving forward with some team support services for them once we have the new director in place. We want to ensure that we're continuing to provide staff the support that they need during this time of transition. We strive to create a culture of excellence where all of our staff feel and are supported to assist us in our long-term organizational success. So to walk you through the next steps, what we're planning on doing is, again, working with our 2 consultants to ensure that we're assessing all areas within PHHS to make sure that we're leveraging best practices and organizational structure as we move forward. We know that we have an opportunity to improve, and we're committed to doing so. Like we've talked about, we have an excellent team within PHHS, but we've had some issues in the past. We know that our staff are committed to serving our community and are doing very well in that space. So we'll continue to focus on rebuilding where we're experiencing issues and also looking at overall operational efficiencies. Again, we're working on the performance improvement plan for our child welfare cases and have completed our compliance plan. And that's what I have. That's what I have for all of you today. Plowman is here for questions. Like I mentioned, I will take the lead on questions related to the investigation or anything in that space, and Jean is here as well if we need her assistance in questions, and Plowman is really focused on the staffing needs and the operational efficiencies as we move forward. Thank you.
Thank you, Administrator Treble. Commissioner Starley.
Thank you for that report. Really appreciate it. I don't know, between you and Plowman, one of the topics that we talked about at AMC is other counties are going through director replacements also. I know it's been about 7 years or better since our last director was here. And so I'm assuming that the update of the job description has been looked to thoroughly because it has obviously changed over the years. So I'm confident that you have done that too.
Yeah, so I know there was a complete look at all of the job descriptions in the recent past in the work with DDA. In addition, when we moved forward with posting the position, I did review the job description. But as we move forward, we'll continue to assess the needs within that space.
Thank you. The picture is interesting. We're just kind of up in the air with things. Is that the point?
Yeah.
Commissioner Gamble.
Yeah, thank you, Mr. Chair. Thank you for the report. It's been a journey, and for some rougher than others, but appreciate and the and understand the context of which you stepped into this. Question I have, given the opportunity because of what we've experienced, is how much evaluation we've done. We have bring people in that have experience and knowledge and have long-term service so that they can give us, perspective to understand this. I think the most important thing is looking at our compliance requirements, things that are mandated, looking at our service needs, and then trying to find alignment with all of that. So we have an opportunity to step back and say, okay, are we rightly aligned in addressing compliance issues and our expectations for service? That's one question. And the other part of that question would be, how much is real-time reporting to staffing compliance issues with policy expectations? In other words, is it a staffing issue that aren't complying with our policy expectations with this real-time reporting? Or is it the archaic systems that our staff are asked to use in order to make these reportings?
So to answer the second question first, the staffing, and I would say that there wasn't necessarily an expectation of compliance.
Okay.
So there was a policy in place, and Plum, and please jump in here as well. There was a policy in place that stated that we needed to be 90%, we needed to be inputting information in 90% of your time into the system. However, there wasn't monthly monitoring of compliance with that. I don't know that there was the necessary support and training for staff, or maybe I should say, I think it would be beneficial at this point in time to kind of refresh the training provided to staff for time entry. And so to me, it was more, as we dug into this issue, that perhaps there wasn't the support and expectation setting at the leadership level.
Okay. Thank you.
Plumman, is that?
Yeah, if I may just add a couple more things. I think if I heard your question correctly, you're asking whether that is mandated requirement. And for some of the programs we work with, that is. But the state itself, the state of Minnesota, does not have a reporting requirement for counties. But many counties, most counties in Minnesota understand that time reporting results in efficiencies for the agencies in the sense of this continuation of service, and also it results in revenue. Why our staff? Well, first of all, we have staff that's meeting that requirement and above, but we have staff that does not. And I think it's a combination of things. It's bringing people, asking them to begin working without providing the onboarding, the support, the training they need, not enforcing it on the management level, and making sure that the job is getting done. That was also part of the issue. How we move forward from this, we provide training for staff and continue to monitor and enforce compliance with the reporting. But there is a balance to that, right? Because when you ask, staff is required to do work with clients on one hand. On the other hand, they need to enter their time in the system. Well, there is always going to be a little bit of which one takes priority here. Well, work with clients will always take priority, but our time reporting is going to be required because for the reasons that I explained above. And many counties we hear have gone through this and done that, so we have some examples of how it's done. And then they are reporting back, well, yeah, at the beginning it was hard for everyone. It took some time to get the training prepared. It took some time to get staff trained. It took some time to get staff into the compliance to some extent. But now everybody takes that as normal part of the job, and we just we don't have to really address it anymore because it's getting done.
And if I can add to your first question regarding evaluation and rightly aligned compliance, I would add that Plumman and I had several discussions about this particular issue, the time reporting, and Plumman spent some time looking at other counties to see how they were addressing this issue. And like he mentioned, there isn't a state requirement for 100%, but what we have learned in that evaluation is that it is a best practice to be at 100% for the reasons that he outlined. And so as we look at changes that are needed, and as we look at updating policies and procedures, we will be leaning on our consultants to do some of that work, but we're also leaning on other counties and some of the associations that we're members of to learn more about what are some of the best practices in these spaces and how are other counties addressing these issues. And so we want to make sure that we find solutions that work for us here in Cook County, but also that we're doing the evaluation that's necessary to make sure that we're implementing the right policies and procedures as we move forward for our clients and for our needs here in Cook County. So we'll continue to do that as we move forward, but that will also take time. We want to make sure that we're training staff as we make changes, and like Plowman mentioned, the client services and client needs are at the forefront of what we're doing in our the primary need. And so we're being mindful of how quickly we implement changes and what plan we need to put in place for that as well.
I appreciate the response, and I certainly affirm and encourage the approach that's being taken. And we have a great opportunity. And I think understanding process contributes to confidence in patience in the process. But I appreciate the approach. Thank you.
Any other questions or comments for Administrator Treble?
Okay, thank you.
Thank you. That moves us down to item 6 in our agenda. We are running short on time, so most likely we will forego our committee reports, but item 6A is a master service agreement and statement of work with Giant.
I can speak to this. So this is a deliverable for the Mobile Crisis Response Base Grant. It is written into the work plan for the grant and fully funded by the grant. And it's a campaign that has 2 aims. One, to increase use of the 988 helpline, and by doing that, increase the call volume for mobile crisis response services. So one of the routes by which a person can receive mobile crisis response services is by calling 988 and screening in for mobile crisis response. Our call volume is and has been very low, and so the purpose of this communications campaign is one way that we can aim to increase calls both to 988 and then calls to 988 that require mobile crisis response services as a way of boosting the number of people using the service locally.
Thank you. Any questions for Grace or Andrea? Please.
Mr. Chair, quickly, so do we have a benchmark to know sort of where we're at right now? You made the reference to the fact that we have a low, so if with these grant monies being used to do this, that we will measure this after this campaign, so to speak, to see the effects of this so that we increase the value or the usage?
Yes, we do. So we receive data from First Call for Help, which is our regional call center. We receive monthly data, and then we receive annual data as well that breaks down all of the demographics for callers in Cook County, including calls that make it to mobile crisis response. So we can we can really break that down between adults and youth, who calls for resources, who calls for support, who gets routed to mobile crisis. We have all of that available.
And the reason for I mean, when you look at something and say, we're wondering why we get so few calls, is it a matter that the public isn't aware of it, or is the need non-existent? We'll just make those two assumptions. So when we invest this, because we feel it's a matter that we need to inform the public, and then we will be more effective in what we provide. So measuring where we're at and then what our expectation is after we go through this, we'll see the effects of this, if it's been effective or not. So that's the reason for the question.
Thank you. Frank?
To follow up on Commissioner Gamble's comment, in evaluating this work and in this campaign, specifically with regard to online things, I would like to make sure that included in this is a report on the effectiveness of the social media. Meaning, if you're directing, as I so often hear, when I'm asked for information, it's, oh, it's on the website, it's on the website, it's on the county website. Okay, it often takes a lot of specific skills to navigate that website. So what I'm looking for is to see the effectiveness of their promotion. Number one, are people going to the website? And I don't just mean the number of hits. Your IT people should be able to provide the number of unique users. And I suspect what you'll find when you look at the number of hits as compared to the number of unique users, especially non-county employee unique users, which they should also be able to identify, that a very large percentage of the people going to the website are people doing it for work. They're going there to add something, or they're going there to look and check something. And I'm just wonder how, I would like to know, and your IT people should be able to tell you, the number of non-unique, non-governmental employees, non-county employees accessing your various websites, various pages over the course of time, monthly, weekly, as a direct result of this or whatever. I'd like to make sure that's built into the evaluation process of this work.
Yeah, sure. I will make note of that. The portion of our website that people will be directed to, besides 988 itself, which is not our website, but is our Be There page on public health, and it outlines ways to be there for yourselves and other people. So I think that it seems like we should do that. I'm not IT, but I will ask. We also have part of Giant's work is to compile data on the digital ads and things like that. And when she asked me, what data do you want? I said I would like all of it, and we'll figure out what's useful or not. So our goal is to be able to have as much data as possible.
Right, and again, specify to break out the non-unique, or the unique users and non-governmental users.
I'll look into that.
Yeah, and I guess I wasn't thinking this was going to be using our website as much as just straight up 988, and maybe like a social media blast, or those kinds of ads that are more focused towards 988. Is that
right? More focused to 988. But when she asked, so it's nice when you have a resource for people to be able to access local things also, if that's the route that they prefer to go. So our Be There page will sort of be that page.
Page?
Yeah. I'll say that the Be There campaign was a campaign we had started last year, so we have some of the assets already created, and we'll be able to use those and direct that same page with some updates. And then there's additional work that will come as a part of this contract. Not all of it is specifically online, so there is a direct mailer to households in the county. There is a billboard included, so there are virtual ways for people to connect to 988 to try to meet people where they're at, regardless of what their preferred method of getting information is.
Thank Thank you. Yeah, Commissioner Rea.
Yeah, thank you, Mr. Chair. I make a motion to approve the master service agreement and statement of work for the marketing from Giant to create and administer an outreach campaign for 988 and mobile crisis response services in Cook County using funds from the mobile crisis response base grant.
Thank you, Commissioner Campbell. We have a motion. Is there support?
I'll support.
Thanks, Commissioner White. We have a motion and support. Further discussion? Hearing or seeing none. All in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. Next item is the Public Health Fund recommendations.
So Frank is going to be presenting much of this as he's our representative from the Public Health and Human Services Advisory Council, who also sits on the grant review subcommittee, but I can give an overview of the public health funds and what our process looks like before I turn it over to Frank to get into some of the specifics. So I believe it was in 2018, the board directed PHHS and public health specifically to administer a grant-making program to local nonprofits whose work aligns with public health purpose. What we've done in the years since then is align our funding requests with the areas identified in our community health assessment as in need of attention and focus. We have a group of 5 individuals who are members of the PHHS Advisory Council who also serve on our grant review subcommittee. My role is to basically keep the wheels turning, make sure we have outreach going into the community to identify that this opportunity is available, to make sure we have information on our website that people can access with application materials, a list of grantees, info session for individuals, and then to make sure that the members of the grant review subcommittee have the applications and all of the materials that they need to assess the applications we receive and make recommendations to the PHHS board for funding. We have a scorecard and a process that involves reviewing both written applications and offering applicants a chance to meet with the grant review group via Zoom to explain the nature of their request. And then the grant review team comes back together to go through each application one by one using the scorecard to make recommendations that then go back before the PHHS Advisory Council and make their way from there to this board for consideration. So I'm happy to take questions on process, but I will turn it over to Frank for explanation on the requests, which you can see linked to in the packet in terms of who applied, the amount of funding requested, the amount of funding that the grant review subcommittee recommended, as well as an applicant by applicant breakdown tied to our priority health area and a short summary of the funding request from each agency.
Thank you, Grace. Grace, could you put the overview chart up on the screen?
I believe that there's a technical issue with PDFs.
It doesn't like PDFs. It likes PowerPoints, but not PDFs.
Okay, well,
I can, though, provide a paper copy of the agenda that includes the recommendations.
and of course, it's in the agenda packet as well, so we can all access it if you have your,
Yeah, you can just add, does anybody not have a copy?
you all have a copy. Okay, great.
Right.
Thank you. Well, first, I would like to thank Grace and the PHHS staff for their support. This was a difficult process, as I'm sure the commissioners understand, making decisions on authoritative allocation of funds, one of the governmental processes, often involves a lot of judgment calls. And the subcommittee weighed the amount of funds available, and understanding that this is going to be a turbulent time for budgets. In the past several years, we've assumed that it was $190,000 that we would have to allocate to these grants. Well, we cut that to $150,000. So we've already took, a substantial reduction in the amount that we're going to recommend to the Public Health Board and the full council that they approve. The second thing is, we evaluated We evaluated the extent to which the request addressed the community health assessment goals. Community health assessment improvement plan, the top 5 priorities involved in the community health assessment program. And further then refined it based on the number of individuals affected and their impact, realizing that a person can take one class or attend one meeting or presentation, and that's an impact. But someone else who is receiving major assistance through, let's say, the Violence Prevention Center might be a very different impact, even though they both count as one. Well, no, not really. So those are all different aspects that we have to take into account. I'd like you to take a look at the funds here. Almost $300,000 was requested, of which we did our best to come up with a fair allocation of the $150,000. Aside from the 2 which did not receive any funding, and again, not because it's not worthy, but because it didn't meet our criteria, meet the subcommittee's criteria for the impact and addressing the community health assessment priorities. But the single biggest application that received the largest reduction was the Cook County Council on Aging, otherwise known as the HUB. We've addressed this in previous meetings, and that not because the things they're doing is not worthy, but simply because we just don't have the funds available, and because much of what they do is an intrinsic governmental process, an essential part of what government needs to provide. It was the sense of the subcommittee and the full advisory council that this should be more directly related to the budget rather than through a grant. So that being said, I'm happy to take any questions on individual allocations. Other than that, after the subcommittee came up with its recommendations, it was presented to the full advisory council, which unanimously approved these recommendations. And I am pleased to be able to provide these recommendations to the Public Health and Human Services Board for their approval.
Thank you, Frank, and thank you for your work on this and your leadership. Certainly is not easy, and really appreciate the process that's been developed. So, Commissioner Gamble.
Yeah, thank you, Mr. Chair. Thank you, Frank. Just to clarify that the recommendation coming from, the committee and the process and all of the different steps that they have gone through on this, this is something that comes under on our agenda as items for board action.
Yes.
And I would just say that my position as a commissioner would be to say that I appreciate the work and accept the recommendation. However, given our budget process, I would not want any action that is taken today to indicate that this might not change based upon further review by the board of the overall budget. That's my position. So, based upon what expectation is from this board, my position would be one to affirm the work that has been done and to appreciate, the recommendation with the understanding that it might change based upon a review of overall budget. The other thing I would say is that I think it'd be beneficial if board members were to see the applications to understand the requirement or the evaluation of what was evaluated. So if we as decision makers are elected to represent taxpayers, I think it's important for us to know the criteria as it was examined, and then we affirm, the effort that was invested in that. But I think it's critical for us to know that, given the responsibility we bear relative to fiscal stewardship. So,
Commissioner Gamble, can I just ask a clarifying question? Are you looking for a packet of all the application materials, or are you looking for the scorecard that lists the criteria used to evaluate?
Just speaking for myself, being able to look at the process informs. So the applications and the results coming from the committee and the scorecard would inform that.
So
And-
both.
And the more, yeah,
Okay.
so
Yeah,
all of
so-
that information is beneficial.
Sure.
Yeah.
Yeah.
If I can respond to Commissioner
Sure.
Gamble's 2 points. First, your first point, we anticipated that $150,000 that we recommend the allocation might not be available. And we've already decided in advance that if it was cut less than 150,000, then each of the recommended amounts would be, although it's our recommendation, would be reduced proportionately.
Yeah.
So if we got 90% of that, then everybody gets 90% of what the recommendation was.
That's
So already
helpful to
done,
know.
yeah. As far as the second, yeah, my recommendation would be absolutely the applications, the written applications, and the scorecards. There's no expectation of confidentiality, I believe, on the scorecards. I personally have no objection to including the scorecards along with the applications. Do you have the individual scorecards of each member?
I have the base scorecard and then the overall score for each reviewer.
Okay, and there's probably no need to see the scores that each individual member assigned, just the total
No.
scores, the total scorecard for each applicant,
Yeah.
cumulative over the five members of the
I
committee.
would agree.
Great,
Okay, thank you, Grace.
thank you. Any other
Thank you,
questions?
And the other part, and Brady isn't here to answer this question, but we have a request from AOA relative to their building project, as Commissioner White knows, and that's $23,000, dollars. And where that is, appears in our '26 budget, I don't know. But when we look at this in the budgeting process with all the requests coming in, as we had from the hub, which is on here, and you see that, they wanted to be a line item, and you addressed it by saying whether this is going to be a budget as opposed to, this coming through this process. And that's why I'm just saying we want to be aware of the total picture of this when we're looking at these dollars, and that this is not something like with the Arrowhead corrections, where we have a participating annual contribution. We anticipate that, so we project it in budget. But when it comes to AOA, if it's a one-time because we're doing something or we're asking that you would participate, that's an unexpected. So where's that falling in our budget is my point, so, yeah. Just saying, if that's going to be here, or did Brady put it someplace else, but it better show up someplace, otherwise the response is saying we can't, so just need to know that.
Okay. Any other questions for Frank? All right, are there any motions? I'll make a motion to approve the Public Health Fund recommendations.
Support.
Thank you. Any further discussion?
Can
Commissioner
you just,
Campbell?
thank you. Can you clarify what approved means, given our conversation?
What approved means given our conversation. There are a list of funding recommendations here, and my motion is to approve those recommendations.
Okay, and why I referenced the given our conversation is the understanding in the previous comments to simply say that it approved the work of the committee in making these recommendations to us. But the approval does not mean that what we're doing is benchmarking this, because it's subject to our budget overall. So that's my position. So there's the big distinction. One is saying we appreciate the work and we accept the recommendations. However, we're not, by this motion, approving and saying we've benchmarked that, and there's no room for change. Because I think in the overall budget, we need to have that opportunity. So the approval is simply to say we approve the recommendation. However, we're not benchmarking and saying it's become a restricted, meaning we can't touch this moving forward in our budget discussions. That's the distinction.
Yeah, I don't know how much we need to read into it. I thought my motion was clear, and I thought the discussion was clear. But if there is a suggested change of wording, I'm open to it.
Well, just clarify for me what you mean by approved. If approved means that it now becomes restricted, meaning that we haven't the right to reevaluate, then I wouldn't support the motion. But if what we're approving is the work and the recommendation with the understanding it's subject to change to further budget review, then I do support the motion.
Okay. Commissioner Sullivan?
I would say in the past, we have always, accepted the recommendations that have come from this group because it's a very thoughtful process. The scoring is done really well. They align with our community assessment. And it has always been up to the board when we do our final budget if there are changes. So this isn't different than any other year. It's just that we all know that budgets are really tight.
So the flexibility exists that change
Absolutely.
beyond this motion. And with that understanding, I certainly support the motion.
Frank?
Commissioner, maybe you want to rephrase the motion that the Public Health and Human Services Board will recommend to the commission or whatever the authoritative budget decision is made, recommend that these recommendations be accepted and forwarded to the decision, but the budgetary decision-making body.
I amend my motion to recommend these recommendations to the Board of Commissioners. Is there
And
some-
I would support that.
Thank you.
And I appreciate the conversation and clarification. Thank you.
Thank you.
Good
A-
job.
Any other conversation, discussion?
I'll recuse myself from the vote.
I just wanted to add one piece of context before the vote. So there's a notification that our department sends after the vote that this is what it says. So I'm pleased to inform you that the PHHS board recommended that your organization receive an award of X. This recommendation was approved by the PHHS board pending final levy approval later in this calendar year. That's the language that we have been sending. So we can change that language, but that has been our process to date,
To inform the
to
recipients.
inform the recipients after this vote. So-
It's pending, subject to review
Right.
in the final budget process.
So,
Would be clear
yes,
based upon the intent of the motion. Does that make sense?
I can work with Administrator
Yeah.
Treble afterwards
Thank you.
to ensure that the wording is
Sure.
reflective of the decision that this
Appreciate
board
that.
makes today.
And can we talk about, a recusal would be appropriate if there is either the benefit or profit or the appearance of such.
Not personally, but since I chaired the advisory council.
Yeah.
Which is making this recommendation.
That would not be an appropriate reason to recuse.
Okay.
So, yes, thank you. Thank you for discussing that with us. All right, plenty of discussion. We have a motion that's been amended, and this amendment has been seconded, and everything seems to be pretty clear here. I'm going to call the vote. All those in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. On to item C here is the COVID implementation grant contract revision.
I can speak to this one too. So we brought this COVID implementation grant to the board's attention this past spring as it was subject to federal clawback and then was reinstated. At that time, the reporting requirements for the grant shifted significantly from, I believe, quarterly to weekly. At this point, they've gone to monthly. However, given the changes that have occurred with the grant, we wanted to bring to the board's attention one important change, which is we now have additional funds available that counties in our regional community health board were not using, and they're proportional to the projected cost of developing a resource directory website, which is item D. So the COVID implementation grant contract revision reflects an increase in our overall grant award of $53,569.
Thank you. Any questions for Grace? They didn't, it wasn't gonna be daily reporting at any time?
No.
Okay. Any motion here to accept the grant contract?
Mr. Chair, I'd like to make a motion to accept the grant contract.
Okay, we have a motion and support. Further discussion here. Motion is from Commissioner Sullivan, support from Rana Plowman.
I'm mindful of the time, of the fact that we're running out of time, but at some point, I think it will be good to clarify for us as the PHHS team, when are we supposed to bring items for board approval? We have some instances in where contracts are covered completely by grants. We have, in this instance, our awarded amount is increasing. So it would be good to set some time aside, I think, to go over that. And so that will streamline things for us, streamline things for the board. We'll be saving time going forward.
Very good point.
Good point. yeah.
Thank you. All right, any other discussion? Hearing or saying none, all those in favor?
Aye.
Aye, opposed? Motion passes unanimously, thank you. And our last item for board action is, as previewed by Grace, the contract with Andy Sites for development of the resource directory website. Anything further you wanted to say there?
I'm happy to provide additional context if requested by the board, but I'm also mindful of time, so I'll leave it to you all to let me know if you'd like additional context on the project.
Yeah, yes, we're running out of time, but we do want to understand, so if there are questions, please ask, or concerns. Commissioner
Mr.
Campbell?
Chair, thank
Yeah.
you. Is this, as with the master service agreement that we approved with Giant, is this contract with Andy Sites, is that grant funded?
It is entirely funded by the COVID response implementation grant that was.
Then I'd make a motion to approve the
I didn't
contract with Andy Sites for development of a resource directory website.
Thank you, Commissioner Campbell. We have a motion as support
Support.
from Commissioner Sullivan. Excellent. Any further discussion here? Hearing or saying none, all those, please.
The only thing I would say is that sometimes the reward for the action is best if it's sort of withheld and not given immediately. And the analogy is simply to say that in the contract, it says, if I read this correctly, unless it's been amended, that the cost for this, that will be paid up front, and then the service is delivered as opposed to a percentage, and then the balance as the reward for job well done.
That was intentional and the contract was reviewed by our county attorney. The reason for that is because the grant itself is seen as less stable because of the federal clawback that
Yeah.
occurred in the spring.
All right.
So the contract language is designed to
Sure.
lower risk
Yeah.
to the county,
Yeah.
while also making as
Yeah.
full use of the grant funds available to us as quickly as possible.
Yeah, well, and that explains why the departure from the norm, so appreciate that, thank you.
It's funny how,
Urgency drives.
yeah,
Spend it while you got
the
it.
intention versus, all of it's just, anyways, thank you. We have a motion and support. Had some discussion. Any other discussion? Hearing or saying none. All those in favor? Aye. Opposed? Motion passes unanimously. And as I mentioned earlier, we're running short on time, so we'll forego the committee reports.
Mr. Chair?
Yes, please.
If I could just, one committee report, make mention of the fact that the Arrowhead Corrections, that they will be here tomorrow, they will be here Friday. So if anybody that has followed, our discussions with our Arrowhead Corrections, which is a partnership with the Arrowhead counties, we will be meeting at 10 o'clock on Friday at the City Hall, new City Hall. So anybody would like to come in and observe and listen to the discussion, I know WTIP is going to participate in an interview, but just wanted to make that notice.
Thank you. Yeah, Administrator Treble.
I'd also mention that we have a short cow agenda, so we might have time for committee reports if it is of interest to the board to move those to the cow agenda.
Well, on that note, Are there other committee reports that anyone would like to fit in right now? Okay. Thank
Thank you,
you.
though.
And thank you for the update with ARC. I'll move us down to item 8, which is adjournment, so we're adjourned. There we are.
Thank you.
Thank you all.
And I should say what cow is instead of
Yep.
saying.
That was our last.
After it came out of my mouth, I'm like.
You know what?
Committee
People that are watching, people that are watching know.
I can say cow, but then sometimes I'm trying to say, and what's that an acronym for?
That was it, right there, I think. Yeah.
Thank you.
Thank you.
We have
It's for milking as much as we can out of the